Good morning, everybody. I know it's been a little while since I have posted a video, and that's cool. I wanted to give some information regarding Sjogrens. It's there. Of course, it's not going to go away, but I have learned some other things about my body, of things that went bad. For about 4 years, I think many of you know I'm a military veteran and was getting my medical care through my local VA hospital. Well, no more, because, well, things with Trump privatizing the VA and stuff, and I just wasn't getting the care. It was terrible. And then they would go, well, just come back in 2-3 months. Well, what they were doing was milking my insurance. You don't get anything for free at the VA, but that's another video. But we're going to move forward. My right hip was really bad. I had to have full hip replacement surgery on June 25th, 2018, and I went through the Cleveland Clinic Lutheran Hospital here in Cleveland. My surgeon was Dr. Kim Stearns, who happens to be the orthopedic doctor for the Cleveland Indians, so I kind of lucked out. When Dr. Stearns was looking at the x-rays and the report, of course, as you know, the hip is a ball joint, there was no cartilage there, and what had happened is the bone here had started to deteriorate, and it was creating bone spurs within that socket. Painful, very painful. The pain, of course, caused my blood pressure to go up, and then the doctor was putting me on blood pressure pills, and I said enough. So I went to go see Dr. Stearns, and the first words out of his mouth, "What took you so long to get here?" Yeah. So we scheduled surgery. My daughter came out to stay with me for a week. We rearranged the house. So luckily I have a bathroom on the first floor, so it worked out really good. Except for a bad reaction to the anesthesia, the surgery itself went 2 thumbs up. Okay. But in the meantime, I have also learned about parathyroid. Now, as you know, your thyroid is here, and I will let you Google all the facts. But within the thyroid, there are 4 tiny little glands, I guess like here, in the thyroid, called the parathyroid. Their only function in the body is to regulate calcium. Okay? And you have to have a specialized PTH, parathyroid hormone test, in order to have that tested. So, my new doctor up the road here, we did a series of 2 PTH tests. It found that my parathyroid, my calcium, was out of whack. Now, the VA had been monitoring blood tests, of course. Let's do a blood test, stab. But they weren't doing anything about what they were finding. So now that we know I have an elevated PTH level, that it's going to be, and I haven't seen a doctor about this yet, but they do a small incision, they go on there, they check all 4 little parathyroids, about the size of a grain of rice, I was told, and they check the hormone levels literally while you're still in this minor surgery, and it's almost immediately that your calcium. And then you go, well, why don't you just drink milk, do this? It's a little bit more complicated. Your body is designed to need calcium. And yes, cottage cheese and cheeses and milk and everything is good for you. We humans are omnivores, so therefore that's why we need, you can't just do all these silly ass diets, vegan only, and I can't drink milk. No, your body is designed that you have to have it. Now, what happens is that if that PTH, that parathyroid, goes unregulated, it affects your kidneys, because the body needs that calcium. So what it's starting to do is leach from your bones, in my case the hip bone, wink wink, the calcium that it was needing. So anyway, I had the surgery. I'm going to be getting seen pretty soon. I'm going to go see a rheumatologist, endocrinologist soon, and to see about what to do about this, to get back on a normal basis. I'm angry because this could have been found out sooner. But I'm letting y'all know about it, so that, because if you have a parathyroid disease, there are things that emulate fibromyalgia, i.e. fatigue and things like that. So next time you see your doctor and it's a fatigue factor and stuff like that, ask him for a PTH, parathyroid hormone test, and see if you have elevated levels in your system. Now, how the parathyroid checks in with the Sjogrens, I'm not quite sure yet. I've been doing some research, but what little bit I found, one doctor says there is a correlation, and because of the general area of it, thyroid, salivary glands, we'll see. It may be a breakthrough, who knows, but it's like, just don't listen to your doctor to say, oh, you're getting older, oh, you're just fat. I hate that. I know I'm fat. I'm sorry. Okay? I have hormone issues. I have a tumor on my pituitary gland. Pituitary sits right here, right there, inside. Okay, so my hormones have been wacky for at least 25 years. And I say 25 years, I just turned 65, and since I was 40. Listen to your body. Ask a lot of questions to your primary care doctor. If they foo-foo you off about, you're just getting older, you're just getting fat, if you just lose some weight, well, when you have a hormone imbalance, you can't lose weight. I don't care if you eat salad and ramen soup, you're not going to lose it. So I just wanted to let you know that there is a possible link between Sjogren's and parathyroid disease. Possible. I'm not a doctor. Disclaimer, I'm not a doctor. But I have a good feeling that there is. But, ask questions, go to different doctors, ask to see an endocrinologist to do the parathyroid test if you think that that's an issue. Since the surgery, I have had no arthritic pain. I'm off the high blood pressure medication. I am off the over-the-counter medications. Yeah, it's yay. So, stay strong, my little showgirl people. And I want you to let me know If you have any questions, again, I'm not a doctor, but I could just tell you what I'm going through. All right, we'll keep you posted. Mwah.